On this episode of Veteran Tech Talk, I'm talking with Jim Gfrerer, Marine Corps veteran and IT thought leader, about VA's effort to do an electronic health record. So Jim, last year you and I talked about this a couple times, and it seemed pretty positive. But I noticed things in the news that are leading me to wonder about it. What's the latest?
Yeah, the latest, Paul, really is that the deployments to the facilities have slid to the right. The schedules have been pushed off quite a bit. As of now, we're looking at a complete work stoppage until June of next year, of 2023. Also, there's been a revised cost estimate around the program. Originally, it was $16 billion. Now it's estimated to be up to $40 to $50 billion, with an increased time frame, probably beyond 2028. So that's the state now.
So let me kind of think about it, right? So it's been delayed, almost stopped. It costs more money, and even in Washington, D.C., these are big dollars, okay? And it seems to me there's a lot of uncertainty. So the idea was a good one, but when we think about what goes on in VA, sometimes these big projects just get stopped. So what are the options, really?
Right. Well, and as a reminder, this is the third time that between DoD and VA they have attempted to modernize their EMR. So it's not a first effort. So it will continue to be scrutinized in 2023 with lots of congressional and external oversight. I think you will see partial deployments that will occur in 2023 and drifting into 2024, and then you'll probably see a renewed scrutiny as the congressional landscape changes in 2024.
So it sounds like in 23, we're going to have a lot to talk about, and there's still a lot of moving parts.
There is, and in the meantime, the existing electronic medical record will be serving veterans, but it's going to require sustainment and modernization of those modules to make sure that it can continue to serve veterans and their healthcare needs.
So if I was a vetting person, does this end in the 20s, or are we talking the 30s, the 2030s?
Well, when you look at an initial 10-year time frame, and I know in the VA, it's a large healthcare system. That's a very aggressive goal. I think you're looking at that slipping even into the 30s.
Well, we'll be talking about this, I'm sure, again in another episode.
Yes.